Hey, everybody, welcome back to our place. We are super excited to have Karissa Menard with us from Hearts Connected. Karissa is a certified child life specialist and does operations for Hearts Connected. I have talked to her, and they are doing some amazing things all across the country with the organization. So, thank you so much for joining us today, Karissa.
Thanks so much for having me, Morgan. I'm excited to be here and share about our services.
So let's start by just telling us a little bit about you and then also Hearts Connected.
Yeah, so a little bit about me. I've been a certified child life specialist for about 8 years. Yeah, 9 years, around there, almost like a decade. And my original kind of part of my career was working in the hospital setting, which is where most child life specialists do work. And I worked in a pediatric hospital down in San Diego for about 5 years, working with patients with pulmonary diseases and traumatic brain injuries and spinal cord injuries. And after COVID, had to have like a little break from the hospital setting, like many healthcare workers did,
Yeah.
and wanted to try utilizing my background and knowledge in like a more community setting style, and worked at a chiropractor office and helped to expand their pediatric programming to be able to include children with sensory processing disorders and developmental delays, and helped to kind of expand their clinic setting there. And then also began working at Hearts Connected around that same time. And I've now since been with Hearts Connected for about 3 years now, and never ever thought that my career would take me to places where I'm doing virtual child life, because it's
Yeah.
typically very clinical in the hospital setting. But it's been a really special experience to be able to bridge that gap and helping to get child life services to families outside of the hospital setting that really need it, and also getting it to families that maybe have never had a hospitalization or a medical experience that led to child life services, but they would still benefit from a child life specialist from helping them. So I lived in San Diego for about 10 years, and I've now moved to Northern California the last year. So I'm now a NorCal girl again. I grew up here. So I came back up here, excited to be back where like my family and stuff are. And I am working now back in the hospital setting about 1 to 2 days a week at a
Oh, okay.
children's hospital up here, just to kind of keep my clinical skills up to date and things like that as well. But yeah, that's like some background about me, personally and professionally. And then Hearts Connected is a mental health company, but we are staffed with only child life specialists. So, child life specialists is a very specific kind of niche mental health field, where we have specific training in medical settings and supporting children and families and teens through medically stressful situations, whether it's a death or a new diagnosis or a procedure, and helping families and kids being able to navigate the challenges involved with medical experiences. And Hearts Connected utilizes that background to be able to help kids and families navigate lots of different challenges beyond just medically stressful situations. So we use our training and background of helping families navigate challenging medical situations to navigate normal life situations like bullying or divorce or a hard time in school, or like anxiety, those type of just like generalized
Yeah.
childhood struggles. And so we really wanted to bridge that gap on being able to help families have better access to mental health support and child life services, and to not have to need to be in the hospital to receive a service like what we provide, and to have access to it from their home whenever and wherever they need it. So we provide services throughout the United States and to Canada, and we've been around for about 4 years now, and it's been such it's like a huge honor and a privilege to be able to reach all these families who have never heard of child life, or they know about child life and they never knew how to get it from home. And so it's been a really special experience to provide this service to so many families in this way.
And that is actually what I was going to ask next. So you might have a lot of people who don't even know what child life specialists do because they haven't had that experience of their child being in the hospital. Yet, especially in the intellectual and developmental disability community, anxiety and school challenges are such a big part of these people's lives. but
Mhm.
because they're not necessarily getting that diagnosis in the hospital, they're not getting that
Exactly.
child life specialist connection to be able to help with that aspect.
Exactly.
So tell families a little bit about like what specifically a child life specialist can help the actual individual who's experiencing the challenges with.
Yeah, so a big thing that we do with kids is we empower them through education. So making sure that they understand their body, their mind, their emotions. They know what is happening within themselves to be able to know how to deal with it, to cope with it, and to move through it. And so that looks like a diagnosis teaching, and we do diagnosis teachings for all different types of diagnoses, whether they're medically related or mental health related, helping them to just be able to understand like what specifically is going on with my body or my mind. And we tailor the information that we give based off of their cognitive age. So we're able to do diagnosis teaching from pretty much like 2 years old to 24 years old. And through the education, we also do a lot of assessments. So we assess, what are the child's possible misconceptions about their diagnosis or about themselves? Do they maybe blame themselves for what's happening? Do they have a misconception or a fear that is causing unnecessary anxiety because no one's ever been honest about what they're actually, going through or what their future holds? And just kind of helping to clear up some of those things and to assess what types of fears and misconceptions might be present there. And then also assessing just emotionally, how is this child coping with it, with their diagnosis, with the challenges that come with their diagnosis, just with general childhood challenges. How are they coping? How is their resilience? What is their ability to be able to adapt and problem solve with the challenges that come with life and with their diagnosis, and then creating coping plans around that. So whatever the challenge is, how can we address it? We normalize it and validate it, but then how can we
Mhm.
also address it and actually have a problem solving focus to it to be able to help that child deal with it or cope more effectively or build better resilient skills? And also really focusing a lot on empowering the parents, because
That's
parents
what I yeah.
oftentimes really feel helpless too on like not knowing how to have a challenging conversation with their child, or not knowing what language to use, or not knowing how to tell their friends about, X, Y, and Z about their child, and helping parents to be able to navigate, what do kids need developmentally to feel safe and to build resilient skills, and how to empower parents to be able to do that with our support, but also without us. That way, they don't
Yeah.
always need us, because we never want to be something that we are a crutch for a child to always need like a mental health professional to get through life. How can we help to empower parents and kids to be successful and build skills where they don't need someone else to kind of navigate them consistently throughout life? How can we help to really build a strong foundation of like resilience and support for them to be able to move through life on their own? And so we really focus on helping parents to be able to use the same skills and techniques that we use so that they can do that consistently at home as well.
Almost like a
That's kind
parent
of the
coaching
focus.
kind of
Yeah,
thing.
yeah,
Yeah.
exactly. Yes, we do have parent coaching as well as like therapeutic sessions for kids too.
Okay.
Mhm.
And for something that's not really talked about very much is like telling your child about their diagnosis in the
Mhm.
first place.
Exactly.
And when is a good time to do that? And how do you do that? And all of
Mhm.
those things. So, do you guys help? Could a parent come to Hearts Connected to get that guidance for that experience, knowing that like they're about to tell their child and
Mhm.
have those conversations and you guys can guide them and then start also working with the child at the same time?
Yeah, exactly. So we help parents to find out, what do they feel most comfortable with, timing wise. We never want to pressure a parent to ever do something that they don't feel is the right thing for their child, because
Right.
they know their child best. And while we do have our professional opinions, we always respect and want to support the parent with what they think is best for their child. And so helping to kind of provide some developmental education to that parent on, what timing would be best, and do you feel comfortable with that? Why or why not? What can we do to kind of match, what we feel is important for that child? And then helping parents to look out for the cues on when the right time is, because um, it might be the right time when they're 2 years old. It might be like the right time when they're 7 years old. And it could be based off of so many different things. And so kind
Yeah.
of helping parents to understand like what cues to look out for. And then really helping parents to know when to not dismiss or shame certain questions, because we might have a child who might start asking questions at 2 or 3 years of age, and that seems too young. But if they're expressing curiosity, we never want to shame them for asking those questions. We want to thank them for coming to us and for trusting us with like a really hard question, and how can we address it in a developmentally appropriate way. And so kind of help parents to kind of look for those cues and how to handle those questions, that they don't feel as intimidating and super overwhelming, but more simplified and empowered to be able to handle those questions. And then we also just kind of help parents to be able to know like what cognitive changes happen over time that
Yeah.
will affect their child's ability to understand and cope with their diagnosis. Because we might tell like a 2-year-old that they have like autism, for example, but their ability to fully understand what autism is at 2 versus at 7 versus at 13, their ability to understand how that diagnosis will affect their life will change, which will then affect how they cope with it. So we help parents to prepare for kind of those different changes that take place as well, that they know how to address the developmental changes and needs of that child as they grow up too.
Which is probably great to be able for parents to be able to take that information into the school system as well and educate the
Exactly.
kids' teachers on all of
Yeah.
those things.
Yeah, we actually do a lot of that. We do a lot of school transition support where we help parents to know how to advocate for like their child at school, what to share with the teacher. We practice scripts with kids on like how to talk to like their peers about it, how to set boundaries. Who do you feel comfortable talking about it with? Who do you not feel comfortable talking about it with? How do you verbalize, boundaries versus sharing something with somebody, and kind of practicing those scripts with kids so that they feel comfortable and confident to have those kind of hard conversations with peers and with teachers as well. And so we're very passionate about making sure that the school space feels as safe for a child as possible.
Yeah. Well, I know schools are big, especially with IEPs.
Yeah.
So tell all of our families, because I think people will watch this and they'll go, what's the difference between a
Mhm.
therapist and a child life specialist? So
Yes,
talk a
yes.
little bit about the differences there.
Yeah, great question. So, a therapist or a psychologist, they have a license that allows them to be able to diagnose, treat, or prescribe medications. We cannot do that. So, as certified child life specialists, we cannot diagnose, treat a diagnosis, or prescribe any medications. But what we can do is provide therapeutic interventions to be able to help kids cope with challenging circumstances. So, from a mental health standpoint, we're both helping to address challenging circumstances. But I will say child life is a little bit more problem solving focused and coping strategy education focused, where we're helping to actually kind of find what the root fear or root cause is, providing some education around it to be able to help that child better understand it, and then teaching them coping skills and teaching them ways to be able to deal with it, versus sometimes what certain therapists or psychologists focus on is cognitive behavioral therapy or certain structured therapeutic techniques that are more structured or focused on kind of processing and validating certain like emotions, whereas we have more of a like a broader spectrum of problem solving, and it's
Yeah.
not as structured or have like a certain guideline to meet. It's a lot more of an open-ended form of therapeutic support, where we're meeting the child where they're at, and we're kind of adapting what we're doing to be able to help them build the most coping skills possible to cope more effectively and be more resilient. I will also say that child life specialists have that specific background and clinical training on helping families to navigate medically stressful situations. So not many therapists or psychologists have that background. So it's a very specific background to child life on being able to lot of our training is being able to break down medical terminology into a child's level of understanding. And so we kind of have more like a medical background to be
Yeah.
able to break down complex information into a way that a child can better understand and prepare them for things like surgeries or dental exams or kind of challenging medical experiences that a therapist might not fully be able to know what that looks like and how to prepare a child for it.
Do you feel like in your experience with the families you worked with that people are utilizing your services as well as therapy services, or like is it good to do them in conjunction, or is it kind of a either or situation?
Yeah, that's a very, very good question. So um, it can kind of vary. I will say that we try to encourage families if they feel like their child needs a diagnosis to happen, then they definitely need to see like a therapist or a psychologist because we can't diagnose and we don't want to do a disservice to that child to be able to receive whatever medications or treatment that they might be needing.
Yeah.
So if a parent is seeking a diagnosis, then we'll always kind of redirect and provide resources for something outside of our scope of practice in that regard. But if it's a child who is needing a diagnosis, but they're also dealing with something that is medically related that we specialize in, then it would be in conjunction with both, where they're receiving therapy for, say, depression, but they're also dealing with typical challenges of like a new diabetes diagnosis and how can we help them to work through that, the more medical piece of things. And so that can be kind of a conjunctive service in that regard. And then also, I will say that it's so hard to see that there's so many kids that are struggling with their mental health, but the wait lists for a therapist are so long, and parents try to get their child in and they have to wait 3 to 5 months to be able to meet with someone when in reality their child might just be dealing with some like generalized anxiety and then they don't have to wait 3 months for a licensed therapist, and we're able to actually provide support to that child tomorrow.
Yeah.
And so we also, I will say, we strongly advocate that if your child is just having general childhood struggles that are normal childhood challenges like bullying or school struggles or divorce or a family member has died, just kind of these hard life things that happen, you don't have to wait for a licensed therapist to have your child start receiving appropriate mental health support. There's people like my company who provide mental health support with no waiting list, and we can't diagnose or treat, but your child might not need that because it's
Yeah.
a more acute, more short-term situational type of need versus a chronic need. So I think that's also kind of a deciding piece too, is the situation or is the mental health need of your child more situational, or is it more chronic where it's needing a diagnosis and treatment, and kind of that will help parents to be able to like decide which provider is best and when is it most appropriate to seek something further than
Yeah.
child life.
And just knowing about all your options. The one
Yeah,
of the big differences and challenges too, and I actually don't know the answer to this. So, as far as one of the barriers for people seeing therapists, it's like lack of insurance, like they don't take insurance
yeah.
and cost and stuff like that. So, are you guys similar in the sense that it's kind of pay out of pocket, or do you guys take insurance? How does that work?
We are also an out-of-pocket company, but because we are certified and not licensed, our prices are significantly cheaper than a therapist would be. Most therapies range from 250 to 350 for like a 1 hour session, like a 45-minute session, and insurance won't always even cover the entire amount. Usually it's like 30 to 70%. And so you're still paying quite a bit from out of pocket. Whereas for our services, it's 125 for a 45-minute session. So it's significantly cheaper than a therapist would cost. And we really try to make our prices as low as possible so that it doesn't become a barrier for families because we don't take insurance, and we want to be able to have families have as much possible access as possible. So we do have an out-of-pocket process, but we also offer financial assistance to families. We have a
Okay, yeah.
financial assistance form through our website where if you qualify based off of like your income and like your need, we also have that available to families as well.
Yeah, I think the cost of therapy services can differ very much by state, but I would agree
Yes.
that not all of them, like, not there are not many that are in the 125 range for sure.
Yes. Yeah.
Um, um, And just like on a side note for people who are watching this too, we have an interview with Deborah Daniels, who is a accountant, and sometimes services like yours can be deducted from your taxes. So like always
Mhm.
ask your accountant if you can get a
Yeah.
doctor to say like child life services are necessary for your child, usually that those services can be taken off of your taxes. So
That's
um
great to know.
yeah. I think Karissa is going to stay with us for another interview on a topic that I'm super excited about, which is siblings.
Yeah.
It is an area that a lot of people request, and there's so little on. So
Yeah.
I'm excited to jump into talking about siblings. I myself am a sibling of a child with, or of a sibling with disabilities. So excited to learn more about that. And Karissa, thank you so much for telling us a little bit about you, Hearts Connected, and how you guys are helping families in the disability community.
Thanks for having me. Of course.
All right, we'll see you guys next time.
Bye.